it is made available to the public, it's oftentimes buried in government sites, websites, or are in very inaccessible formats. And so what we do at OpenAQ is harmonize that data from across the globe. And we currently have 600 million air quality measurements from 95 countries available open source, free to the public. And our goal is really to be very fully transparent about the data that's available. And by doing so, we're aiming to equip academic researchers and journalists, software developers, community activists, and policymakers to really make the change on the ground by providing that foundational infrastructure.
Thanks, and I really appreciate your use of the term harmonize, because it can be very jarring and kind of dissonant when you're trying to bring two different data streams together. I'm just speaking from my experience working with these data and some of these different monitors. Crystal, and then I just also I see Tyler has joined us. So hi, Tyler. We're doing introductions right now. And so I'll circle to you last, but right now let's hear from Crystal.
Thank you, Jan. Hello, everyone. It's a pleasure to be here today and would like to extend gratitude to the University of Maryland for inviting me to participate and for hosting this really pertinent symposium. As Jan mentioned, my name is Dr. Crystal Upperman. I'm a senior scientist at Aclima, and at Aclima, we've introduced a new way to measure and analyze hyperlocal air pollution and greenhouse gases for entire regions. We use a combination of mobile and stationary sensing to accomplish this task. And we've spent years refining our mobile mapping approach, which uses fleets of vehicles as roving sensor network. Vehicles are equipped with our internet connected sensing technology, and our fleet actually measures block by block across times of day and day of week in order to get a high resolution picture of street level pollution. So our research actually has shown that these pollution levels that we collect at hyperlocal scale can consistently vary from one block to the next, which speaks to the importance of hyperlocal measurements. The parameters that we actually collect include PM 2.5, ozone, black carbon, nitrogen dioxide, nitric oxide, carbon monoxide, and carbon dioxide, including methane and ethane. So currently, actually, the Aclima fleet is mapping across California, as well in parts of New York and Mexico, including the 9-county region within the Bay Area Air Quality Management District, and in major cities around the world with a fleet of partners like Google. So I would actually like to share a really quick overview of our work supporting community-led emissions reductions, which is particularly why we're here to talk about how our technologies can fit within the context of supporting communities in EJ. And this work actually was done in collaboration with the Bay Area Air Quality Management District and local environmental justice leaders, including the West Oakland Environmental Indicators Project and the RISE Youth Program. So I'm going to share very quickly.
What we're here to celebrate today is the hyperlocal air quality data in the 9-county region. This project will help shine a light on the disparity of health impacts faced by many in the region, and it will inform lawmakers to better guide our decision-making process to protect the health of all Bay Area residents moving forward.
So for the first time for an entire region, low-emission cars will be equipped with air quality sensing devices as they drive multiple times over every publicly accessible street in the Bay Area. That's a region with over 7.5 million people and covering 5,000 square miles. The data collected through these drives will be combined with other air district data to map out block by block air quality across a range of pollutants, including fine particulates, ozone, and nitrogen dioxide.
A lot of people in our community can say what's going on, understand that stuff isn't right, but they don't have the data to back it up. And with Aclima, it was the first time that we can get data to back up the suspicions that people in the community have. And part of this Aclima project makes sure that they feel like they feel invested in, and that they care and they matter.
Research has shown that air pollution levels can vary from 5 to 8 times from one end of the city block to another, and that variation can persist over months.
Today, as we send the first of our mapping fleet into Santa Clara County, we reach a momentous milestone in our work. We are so honored to be of service to the Bay Area Air Quality Management District and to our community. This program will bring an unprecedented level of visibility into air pollution and climate changing emissions to the region it serves.
Now, while the Air District has one of the most extensive air quality monitoring networks in the nation, we haven't been able to drill down to the neighborhood level.
This new data will help us identify pollution hotspots in order to strengthen and target our actions to reduce emissions.
Thank you again for joining us. We really see this as just the beginning of our story together, with much work ahead to ensure a healthy Bay Area for all.
Thanks for that, Crystal.
You're very welcome.
Tyler, are you there? Oh, sorry. Did I
No,
cut you off, Crystal?
No, you did not, Jan. Thank you.
Hi, good morning, good afternoon, everyone.
Good morning. Good.
It's great to be here.
Thank you. So the question posed was how does, how does, in your case, Plume Labs fit into this movement for making data more democratic, more accessible to communities? And if you could introduce yourself and your position at Plume.
Sure, thank you. My name's Tyler Knowlton, and I am officially the Director of Communications at Plume Labs, but my background actually lies in deliberative policy development, where I worked for the Canadian federal government for many years, working on bringing more voices into the policymaking process. So that helps frame my lens on my work at Plume Labs. So a little bit about Plume Labs and how we fit in, and I prepared some slides, but I think my introduction has been very well covered already about variability, the importance of hyperlocal data, and how that data can be used to help people make decisions, both for individuals and at the institutional and research level. But where Plume Labs is a little bit different in our approach to providing that data, it lies in the micro and the macro strategy that we take to closing the data gaps that exist. And when I say micro, I mean the personal, crowdsourced, individual person being able to bring their personal air into a mapping system. And then on the macro, taking a planet scale look at the trends and evolution of air quality at the city level, the neighborhood level, country level, you name it. But really going from that ultra local personal level right up to the planet scale. And we do that in two ways. We create really mobile to the point of wearable sensors, and we use a lot of math and machine learning. And so we scrape the world for data. We take data from stationary monitoring units that would be run by a government agency, for example. US Embassy is always a great source of data around the world. We use weather, satellite imagery, population density, land use regression modeling, anything we can get our hands on that will help us build a model of air. Just like forecasting the weather, we forecast air quality, but we also map using this data. And just like we just saw, the importance of that variability down to the street level is critical. And to be able to do it without a vast number of sensors is something we're looking at through our modeling. I can share a couple slides here for you. One moment, please. This is my looking for slides face. Okay. Now, let's take a look here at So we've talked about variability, but when you look at sensors, our personal air quality monitor it's really small, and it's meant to be worn on the person. So it goes where the individual goes and breathes what they breathe, and then sends the data back to their app and to a system. But when you look at the macro scale, all of these layers fit into creating the models and the maps. But what's really interesting, I think, to talk about in this conversation is the intersection between the personal and the public. And one of the major challenges that we come up against when we're looking to provide this level of data without ground source is context. So there were lots of technical challenges in creating small sensors, miniaturization, and all of these things. But how do you know where that sensor is when it's taking the measure? Is it in someone's handbag? Is it on a bicycle, in a bus, at home, in the bath? Did it fall in the toilet? These are all things that we have to figure out before we can bring a crowdsourced data set into a broader model. And I was actually at a conference a couple of years ago in Germany talking about this and discussing with the group, and the lines were so clear between those who thought it was a good thing and those who thought it was a bad thing. And I think a lot has changed in 2 years. A lot of progress has been made. But our goal in closing those gaps is to be able to create a truly data platform that is hardware supported. But when I say hardware, that really comes from the individual, that allows individuals to donate their data through data philanthropy or whatever model works best, and have that integrated in a useful way into a reference map. And so that's what we're working on right now. We really believe that once you can measure it, the dialogue changes completely. And I think that's very much in line with what we're talking about today, the critical importance of that hyperlocal data.
Thank you, thank you. So my next question has to do with the global pandemic. And of course, I'm sure all of you on the panel, and maybe several of you also in the audience, have heard about the associations between air pollution and COVID-19 risk. So can any of you speak to how this has come up in your work, in your modeling of air pollution, if you're developing certain dashboards specific to COVID-19, or how are you using these findings and these data? So I'll start with Michael.
So I received an email from Sukabi recently, and he talked about the syndemic, talking about the pandemic as a syndemic rather than a pandemic, to call attention to the fact that what is actually happening on the ground is very different from city to city, region to region, country to country, and even neighborhood to neighborhood. And that you have, what happens is that you have COVID-19, but then you have that laid on top of lack of access to healthcare, diabetes, poor housing conditions. And so you have this convergence of multiple health disparities, health impacts within a particular context. And so I wouldn't say that we're doing anything particularly with our platform to address COVID-19, but what we're seeing is that even as we look at how the air casting platform and the Airbeam are used in different contexts, is that everyone's air pollution issue is a little bit different. You might have a problem with PM 2.5 in one neighborhood and it's related to trucking activity. In another neighborhood, it might be construction. And then you have the social and the political context in which you're struggling to make change. And that comes together and converges with all of these health disparities. And those are different from place to place. And so it's not so much that we've done anything particular with our platform to address COVID-19, but what we've seen is how groups that have been struggling with poor air quality for decades and generations are understanding and coming to understand this concept of a syndemic, something they're already intimately familiar with because they're always talking about the intersectionality of all these different issues. And that's what's coming to the fore here, is that you can't address COVID-19 by itself. You have to really dig in and understand the social context. You have to understand all of the different health disparities that these communities are facing and how it changes from context to context. And the same things that apply here in terms of addressing COVID-19 are the same things that apply in addressing any kind of air quality issue. There's not a one-size-fits-all approach. You really have to start from the grassroots, because when you start from the grassroots, you're going to make sure you kind of bring all these strands together in order when you're developing the solution.
Thank you. Anyone else want to talk about this question?
I can jump in with a specific example. Earlier on this year, when research was just starting to come out about the links between particulate matter, air quality, and and COVID-19, we took a look across what we offer in terms of products and platforms and skills within the company to see what we could do. And it became clear that where we fit, where we can help and add value is in the recovery phase. So patients who have had severe cases of the virus and have recovered are often left with reduced lung capacity, all kinds of respiratory issues following their infection and their fight with COVID. And what we want to do is to be able to reduce a relapse, not necessarily of the virus, but a rehospitalization caused by extreme exposure to pollution, which could lead to a respiratory distress and a readmission to the ER, for example. So when you've got an already overstretched healthcare system, the last thing you want is to enter into pollution peak season in Poland and have everybody have to go back to the ER because of some sort of respiratory distress. So our prediction and modeling system can help with that. So looking at how we could add specific coaching tools, predictions to help people, take action before the peak sets in. I think that's where we can really add value in the recovery effort.
Jan, the other panelists have really covered the disproportionate impacts of air pollution and subsequently the pandemic outcomes in environmental justice communities very well. In contrast, we've also seen in this time an unexpected sudden change in the emissions that disproportionately impact such communities. Like many things 2020, it's really been stunning for us to see the huge drop in pollutant levels during the first weeks of shelter in place. And then just a few months later, the worst sustained air quality on record in parts of California that have been caused by historical and early destructive wildfire season. In particular in California, when we looked at the average pollutant levels on weekdays during the first 3 weeks of shelter in place and compared those with the same time period in 3 years prior using regulatory data. And that data actually came from the California Air Resources Board. What we saw across the board was a decline in a series of air pollutants. For instance, for ozone, there was about a 5% drop. For carbon monoxide, about 24% decline. PM 2.5 was 41% reduced. NO, 34% reduction. And black carbon, there was a 38% reduction. And then from February to April of this year, we saw decreases particularly in NO2 across every single county in California. And the decrease in NO2 is in large part likely due to a reduction of vehicle miles traveled and reduced traffic congestion as people were reducing their commutes to work, working from home, and attendance at school was put off due to the pandemic. And certainly these declines weren't at all uniform, which is concerning. They certainly didn't last forever. What we saw ended up seeing a noted rebound happening in portside communities starting in mid to late April. So there's much work to be done parsing the impacts of different vehicle emission sources, such as like shipping, as opposed to commuter traffic during the pandemic, because we've continued to measure hyperlocal air quality over the 5,000 square miles throughout this time. And we have ground truth data set from which we can glean more insights that can showcase the varying impacts of reducing transportation emissions on different communities for sure. So, yeah.
Thanks.
I can just add from OpenAQ side, from the data infrastructure side, it's been really interesting to observe an uptick in API requests. So since COVID-19 has been publicly known in March 2020, API requests on the OpenAQ platform have nearly doubled from 30 million to 60 million API requests. Of course, there's no real way to directly correlate that with COVID-19 in isolation. But I think that this is a clear indication that there is an interest in air quality data at this time and conducting various studies. This isn't particularly linked directly to health, but from a global perspective, there was a study that was conducted that cited OpenAQ where they compared the nitrogen dioxide and particulate matter levels from across 34 countries since the lockdowns. And they have concluded that approximately 60% of NO2 and particulate matter levels have gone down since the lockdowns. And this has helped inform a lot of at the government level, different policies. So that's a really great kind of study and indication that governments around the globe are becoming much more aware of the potential of especially making some regulations within the transportation sector. And another more localized study in northern India conducted by Urban Emissions, they also tracked the PM2.5, PM10, and nitrogen dioxide levels as well, and similarly concluded a significant drop. And so I think that as scientists in particular start to understand the correlation between COVID-19, air pollution, and health effects, we anticipate that we'll be continuing to get more of an increase in API requests from around the globe.
Thank you. And what that really speaks to me is the importance of having these different approaches to monitoring air quality, and having on the whether it's the front end side with the specific sensors or the back end side aggregating the data, harmonizing the data, as you said, and kind of dovetailing with that. Now moving on to Michael, you talked about addressing air pollution and addressing these disparities. So each of your tools, as I opened up the session, I said, really help to democratize the availability of this data, the understandability, the use of these data, which gives communities a critical tool for something that they never should have to do in the first place, which is prove that they're being differentially impacted. The burden of proof lies with the community when they're being poisoned. And so this gives them a tool to fight back. However, it's not simply a one-to-one, take this tool, use it, and get the data, and then give the data to an elected official or a policymaker. It's a much more kind of complicated process. And so I wanted to get all of your kind of opinions or your takes on this process of QCing the data, making sure that there's a rigorous research method and approach applied to how you use the sensors, because even if a community is able to get a hold of a federal reference method monitor, a dust track or some such monitor, they still might not understand necessarily that it's not just the device itself, it's how it's used and how it's applied. So I'll go back to you, Michael.
This is a really important question. It's come up again and again. It's been kind of the, something that has hung, I should say, over the field for a very long time. The idea that an individual, a citizen, or a community member taking an air quality measurement with a low-cost device, can it be trusted? And the debate is still raging, but maybe I'd frame it like this. The attempt is to know something true. And the thing that we're trying to know is that we're trying to know how much of this particular pollutant did you breathe in, and then what was the health impact as a result of breathing that in. So before we even get into QA/QC, there's all sorts of other things that are in place. So we evaluate instruments, we compare them to reference instruments. You know, we do quality control when we manufacture them to make sure there's not too much variability between instruments. But the fact of the matter is it's a very base level. There's unknowns that we, even with the best instruments and the best scientists, we don't know. For instance, we don't measure ultrafine particles. The EPA does not measure ultrafine particles. They measure PM 2.5. And we know that if you're measuring PM 2.5, ultrafines, which are the most hazardous component of the PM 2.5 fraction, are going to be undercounted, underassessed, undervalued, because they don't weigh a lot. They're very small, they're very hazardous, but when you're looking at the part of PM 2.5, they don't make up a lot of that mass, right? In addition, the AQI, the air quality index, is based on a 24-hour exposure or an annual exposure. You know, that's not the way we breathe. We breathe second to second, breath to breath. And the science isn't clear. There is science that says, you know, high exposures over short periods of time can lead to acute health effects. But that science is just now emerging, and it's not something that's kind of mainstream. It's not something the EPA uses to put out their AQI. So at the base level is that we're trying to know something, and it's about human exposure and the health effects of that exposure. And so QA/QC is one way to do that. But even at the best level, there's still many unknowns. So no one has claimed to say they're the only ones who know how to measure air quality and assess health impacts. There's gaps. There's gaps all over the place. And so for QA/QC, you have to consider what's the end use of your data. And so how good does your QA/QC need to be? How good does your instrument need to be based on the effort that you're putting forward, your goals, and your claims that you're making? And so when we're working with communities, you know, the first thing is that we never released and sold an instrument until we had done our homework and we're sure that we could release an instrument that was accurate and reliable and small and low cost and open source, because we know that communities need to make claims when they make these measurements. We also know that they don't need to have an instrument that costs $20,000 to make that claim. And we also know that there's no safe level of exposure to PM 2.5. And so I don't need a perfect instrument if I'm going out and I'm saying, carry this with you all day, or put it outside your home where you have a concern about the business next to you, and you're seeing that those measurements are 5, 6, 7 times the concentration that's registered from the closest reference monitoring station, right? And so I don't need perfect data depending on what my context is. So your QA/QC should be done in proportion to the outcomes that you're seeking and the claims that you're seeking to make. And oftentimes communities that we're working with are so overburdened by pollution and have lots of evidence in terms of, you know, disparate health impacts. We see that asthma hospitalizations, morbidity are higher in these neighborhoods as a result of air pollution exposures. So it's not so much, I would say, solely about generating this piece of data that you're going to present to elected officials or policymakers or your enforcement agency. It's part of making the overall case, right? And so, you know, in a world where, you know, vociferously put forth disinformation becomes fact, I think is illustrative of the point that it's not really so much about how great and perfect your data is, so much as it is about how you come forward with a comprehensive strategy that explains what you're doing to the public and makes claims that can be substantiated by that evidence, but also doesn't restrict yourself to that. That anecdotal evidence, that evidence from the community that says, this many people in my neighborhood have cancer, this many people in my neighborhood are sick, this many kids are missing school. Well, it's not this kind of, we're going to put 1 to 1 together and get 2, but it's the overall, you know, campaign itself, that getting that data is one small piece of it. And it's one small piece that these communities have been working on for a long time. Now they're starting to collect this little bit of data to present it. But they also have ongoing campaigns, ongoing concerns, and they have the intersection of these. So that climate justice, for instance, is a representation of this, that yes, they're concerned about air quality, but air quality and health impacts is related to the co-pollutants that come along with the greenhouse gases that aren't necessarily hazardous. But those greenhouse gases are, you know, creating storm surge issues in the neighborhood, you know, in the communities, more frequent hurricanes, more frequent wildfires. So just getting back to the idea that, you know, QA/QC is one tiny part. It will always be kind of criticized. It will always be a bone of contention, as it is even in just science and not community science work, and as it should be. But then I also think we need to take into account that, you know, this is just one small piece of a bigger puzzle that communities are faced with in terms of putting together a strategy and a campaign to address clean air issues.
Excellent, absolutely. Thanks for that answer. Would anyone else like to add?
Yeah, I think, yeah, very much echo what Michael is saying. It's also really interesting from I guess, understanding the scientific knowledge production process that obviously these kind of metric-based understandings of air pollution have really dominated and has become the dominant paradigm under which communities have to legitimize what they've been breathing and feeling, etc. And it really takes away the fact that people have been knowledge making around air quality for decades and decades. So I think that we need to be mindful, particularly as we're engaging in you know, spheres of science, for example, that people in communities around the globe have been creating knowledge around air pollution for a long, long time. And I think that we need to keep asking the question, especially from an environmental justice perspective. So, you know, who actually gets to make these claims about quote unquote quality of the air quality data, the low cost sensing data, and who really is actually left out in that conversation. So I think that, you know, there will always be scientific communities, for example, that will question the validity of the data. But in the big picture, very much like what Michael says, what we've observed at OpenAQ is really that what's more important or equally important is how people communicate that air quality data than the source of the data itself. We found that coalition building is a really effective way to communicate those demands from the community. For example, you know, we've organized community workshops in areas around the world, including in Delhi and Sarajevo and Ulaanbaatar and Nairobi. And as an example, in Accra, Ghana, we organized this workshop bringing together all sorts of diverse stakeholders, from researchers and journalists, software activists. So everyone who would never necessarily claim to be air pollution experts, but are very heavily invested in making a difference in their communities because they have this tangential, very visceral kind of experience living and breathing and being born and growing up in these communities. And so building this coalition and really having a platform, a foundational platform for communities to really define what those next steps are and identifying exactly what the challenges are that the community is facing. And for not US-based institutions to, you know, be able to dictate, hey, this is what we think the solution should be, but really allowing for essentially space for people from different fields to really come together and co-ideate what is the most effective way to communicate to their local government. And so as a result of this workshop, the community decided that creating a community statement to demand specifically to increase coverage around air quality data and also the frequency of air quality monitoring in Ghana was the best way forward. And so they created this community statement, which was later published in the Clean Air Journal, got international coverage, and learning from this initiative, Columbia University donated air quality monitoring equipment to the local community network. And that local community network is continuing to grow and being able to have more of a spotlight around the air quality sort of data gaps within their community. And so while this isn't necessarily like a strict policy change yet at this stage, I think it's important to celebrate these incremental but profound steps that communities are taking. And in order, we really believe that partnerships are key. And sometimes, you know, transnational partnerships, I mean, this is Accra, Ghana connecting to Columbia University. It's not necessarily something that people would necessarily think of. And so for us, being able to provide the data transparently and openly, and also being able to connect people from different parts of the globe have been a really effective way to communicate and make change, even though incremental, in profound ways.
Yeah.
Definitely. Crystal.
Sure. If Tyler doesn't have any comments as of yet, definitely, you know, we at Aclima, we map hyperlocal air pollution, particularly for the impetus of it is to support planning and decision-making by governments, communities, and businesses, all so that we can reduce emissions and duly noted their impacts on public health and our climate. Like that's really important. You know, we provide, of course, a cloud-based software product that's called Aclima Pro that generates insights for our subscribers using advanced visualization and analytics. But we also share free online resources that community members can use to look up street level and real-time air pollution and greenhouse gas concentrations by their address. So we've learned so much and continue to learn from community members and advocates who are leading the charge on environmental justice. Just for example, in support of California Assembly Bill 617, we work with environmental justice groups like Mothers Out Front in San Diego, and also the West Oakland Environmental Indicators Project in the Bay Area, along with regulators like the Bay Area Air Quality Management District and the San Diego Air Pollution Control District, to provide this hyperlocal air quality data that's used to inform their community-led emissions reductions plans. So to get to your question, Jan, about like QA/QC, Aclima supports communities both by providing a quality assured and quality control process into its measurements and analysis of the platform. We do that so we can reduce friction in terms of, you know, getting to meaningful information that can lead to emissions reductions. And secondly, we help to actually translate complex measurements into insights. So not just leaving it as these are the measurements, but taking it a bit further. But we know, as was mentioned earlier, you know, our work is really only half of the story. The critical enabler here is that community observations and context is essential. We can't make sense of the data without that. Just last year, we started working with frontline and fence line communities in West Oakland, in Richmond, San Pablo, and in San Diego to develop this new public platform where members of the public can look up street level seasonal air pollution by averages by their address. And this work was actually funded by the California Air Resources Board, and implementation has been and continues to be led in partnership with communities and regional air quality regulatory agencies. So getting to the comments of that, you know, making this a democratic process is very important and is essential across the board. So we support that and do agree with those sentiments.
I don't know if there's too much I can add after that rigorous run through the topic, but I think an interesting place for low-cost sensors is to actually accelerate the investigation process. And what I mean by that, and if I can give an example, it's a strange example where we work very closely with Broadway musicians who were experiencing respiratory distress, and they suspected it to be stage fog during the show. So, you know, 3 performances, breathing in this smoke, and they wanted to be able to go to their union to not be exposed to this smog anymore. Now, where we can help is to help figure out, is it actually the stage fog? What is it in the stage fog, if it is, that's causing the problems? And then take that information to a university or to an agency and bring that data to the level that a union would need to be able to make a decision with that. And where our expertise can help is in network building with people like yourselves and universities and governments. We're able to help our community members determine at what level of government should they be bringing this, and when those levers have been identified, what do those decision makers need to be able to proceed? From taking a policy perspective, if there is a desire to engage with the community, and that's very important, that desire often doesn't exist, but if there is a desire, what are those policymakers and public servants bound by to be able to proceed to the next level of the policy process? And I think that's where the QA, QC is really important, to know what the decision makers who hold the power, if you can't claw it back, how do you get into that? What do they need to be able to make a decision based on your findings? And that's often a very complex and complicated process. So if we can add value there by starting the investigation and speeding it up, then we do so.
Excellent, thank you all. So keeping in the vein of community science, which previously referred to as citizen science, but community science is a bit more of a more inclusive term, because you don't need to be a citizen of anywhere to want to engage in improving your environment, improving your neighborhood. So doing science in this way, in this kind of informal setting, has typically historically been very well known in more affluent, white, suburban communities, which may not necessarily be the ones, particularly if we're talking about air pollution, may not be the most impacted communities. So how are each of you and your organizations and your technologies going about making sure that your work is penetrating where it's needed most? And when, for example, communities of color, and also in terms of the benefits of getting involved, particularly from my experience at a young age with citizen science as a backyard birder back in the way back days. There are so many benefits of being introduced to STEM in this community science avenue. So how are you making sure that what you're doing penetrates to these areas where you have populations that historically are not getting introduced to these STEM fields, not getting introduced to citizen or community science, or these environmental justice communities? And I'll start with Chisato.
Yeah, I think from, as an organization, I think that we are at an inflection point where we're really recommitting to this and kind of revisiting our mission and ensuring that when we talk about air inequality, who is accessing the platform and who is not. So it's still a work in progress, but we will say that we've taken some measures this year in trying to make the platform more accessible. We understand that right now, people who access the platform do have to have some working knowledge of API, have to have some knowledge of coding. And so that obviously in and of itself is a barrier. Of course, when we are adding data onto the platform, we have to be mindful of our own biases on how we prioritize which data sources to add, because obviously that will also impact how the map of the air quality data that's available is represented to the public as well. And from a sort of tool building perspective, we are collaborating as part of the Opportunity Project, which is supported by the US Census Bureau. And through that project, we're developing a tool, a platform interface that will make the data more accessible and user-friendly. Essentially, for people who don't have coding or experience with the API to be able to access the data and understand and create comparisons between locations. And we're hoping to integrate a more grassroots approach to our work as we continue to partner with community-based community organizations to ensure the platform is designed. We typically conduct an annual community survey, but we are also, as an organization, recognizing that this type of outreach, even if it's to gain feedback from the broader community, we need to be mindful about how we're reaching these communities and who isn't part of that process to give us feedback. So I think that we want to partner with community organizations to ensure that the feedback loop is consistent and is inclusive of people with different types of expertise, including scientific and non-scientific expertise, as well as different types of users of the platform, so that we're able to have continual feedback through multiple year. One other initiative that we're actually going to be launching early next year is an ambassador program. This will be a global program where we recruit local leaders to serve as the mediator between air quality data collection and ground action. So as part of this program, curriculum will be integrating training on how to access the data on the OpenAQ platform. This includes the government grade and the low-cost sensing platform that we'll be launching in December this year. Also supporting the cohort with important resources on air quality data, as well as equipping the leaders with various tools to organize the community workshops, as in the example that I gave for Accra, Ghana. And these workshops really are designed to bring together diverse stakeholders so that they can collectively assess the problem and to be able to make change on the ground. And this is, I think, really important, especially as an organization, that we don't define what counts as success on behalf of communities, but enabling or creating a program that will equip leaders with skills so that when it comes to defining the success on the ground, it's something that is on their own terms and something that we can continue to support from afar.
Excellent, thanks. Tyler, do you want to add, or?
Sure. So if we think about Plume Labs as having two sides to the company, there's the devices, the flow personal pollution sensor, but then there's the data side as well. And the two are often intertwined. But on the data side, we make sure that we provide access to that data to any community group who needs it, any researcher, and that's done along with our expertise to help with that. On the devices side, it's more complicated because it's a consumer device. And so what we're doing is, I guess a specific example is in Houston. And we have a partnership with a not-for-profit in Houston called Houston Air Champions. And they actually provide scholarships to anyone who wants to apply. And that scholarship includes a free pollution monitor, how to use it, educational materials. And so anyone can sign up to become a Houston Air Champion, get their sensor, and then go and start using it. And they're connected to that community. And the trick here is how to pay for all of that. And so, you know, we can do what we can on our side for selling the sensor, and then the Air Champions not-for-profit can do fundraising to cover off those scholarships. And so they can take donations and then the scholarship goes out. So figuring out what a model of distribution could be for this type of initiative. And that particular program resonated really well with teachers. You can imagine, oh, I can apply for 30 scholarships for my whole class. And so that led to a partnership with the Children's Environmental Literacy Foundation to be able to take advantage of this model and distribute sensors to teachers throughout the US who are part of that network. So we have to be clever in how we figure out a distribution that makes sense, because we're a company and we have a data side and a device side, and we've got to sell the devices in order to fund all these awesome efforts. So it's a dance that we have to do, but with some creative structure, we can come up with ideas like this, and hopefully we'll find one that we can replicate. So if Houston Air Champions takes off and it's working, why not do it in New York, do it in LA? So figuring out what works and what resonates with the community and what makes sense and is accessible.
You know, Jan, if I can interject at this point, it really is refreshing to hear so many complementary efforts that are underway to just extend the benefits of community science to environmental justice communities. As I mentioned before, Aclima, we share online resources that are accessible by web browser for community members to use. They can look up the street level and real-time air pollution and greenhouse gases by address. And that's currently freely available in Spanish and English in environmental justice communities in California. And one thing, our platform measures block by block independently without requiring community members to purchase, install, or maintain sensors. So our fleet and also our fleet operators actually live in the communities that we serve. And our Aclima employees with benefits. And this approach actually provides jobs and access to on-the-job training that can convey new skills and knowledge to underrepresented populations. And we also do partner with local businesses, including churches, restaurants, and as I mentioned before, a myriad of community groups where we install and maintain calibrated stationary sensors. So our model kind of shifts from the cost burden, putting the cost burden on communities to making it away from community members onto more so governments and businesses. So that's how we approach it.
Thank you. Michael?
So we take an approach that I might term use case driven development, meaning that there's never been a website feature or a tool or a program that we developed that wasn't developed hand in hand with a community-based organization. And as an instance of that, take for instance the development of the first Airbeam. We're now on the third iteration of the Airbeam, working on it now. And with the first iteration, the way we developed it was we actually got faculty, a mechanical engineering professor and an electrical engineering professor from a CUNY college, New York City College of Technology. And we brought them into a public school in Queens, and we taught them how to build kind of early prototype versions of the Airbeam. We taught them how to not only put together the electronics, but also how to 3D print the enclosure. And then we had them make modifications to it. And then we had them go out actually into the community where they were. And we set up a partnership between the students and the school and a community-based organization that I'm on the board of called the Newtown Creek Alliance. And so here we're bringing STEM into the classroom with college professors into a high school classroom, public school classroom. And then we're connecting those students also to the actual area around their school. In New York City, people don't necessarily come to a high school that's in their neighborhood. They come from a lot of different places and come into the neighborhood. And so even though they go to school every day in that neighborhood, many of them weren't familiar with all of the industrial uses that surrounded them, because Newtown Creek is the largest industrial zoned area of the city. It spans Brooklyn and Queens. And so this was a perfect example of how we develop our tools, not only because it's part of our mission, but also because it's the way we get funded, right? In my almost 15 years of running Habitat Map, I've never had anybody give me a $50K grant to make a device or make a website. It's always to run a program, and run a program in partnership with a school or a community. And so that's exactly how our technological development happens. And that's how we're community science at the core, because there's nothing we've ever done that wasn't informed by those use cases. It says, we need to do something here, or we have a bit of feedback for you here. And that's what drives our development.
Excellent. Excellent. We have about 20 minutes left in the session, and I want to devote the last 10 for audience questions. So audience members, if you have questions, go ahead and add them to the chat. Or when we get to the Q&A, you can turn on your video or turn off your microphone and ask the question directly to our panelists. So this next question might be, depending on where we go with it, might be one of the last questions or the last questions. And so it's kind of looking forward, looking at the present and looking ahead. What do each of you see as the kind of critical gaps in how this work is being done, this community science air quality monitoring work is being done? And you can take it from the user side or the back end side, from the stationary monitoring side, personal monitoring. But what do you see as the critical gaps that needs to be solved in order for the field to move forward, particularly for the benefit of communities? And so I'll start this one off with Crystal. Oh, you're muted.
Yes, I'll get off mute. Hi. Well, that's a really good question. And, at Aclima, science has been driving our organization from day one. As a company, the company was co-founded and is led by a woman founder, Davida Herzl. And we've had very high rates of diversity across the organization, with majority of our science team and leadership actually being women. And amazing things happen when you start with that diversity and inclusion at the core. And it's a central value that guides what we do at Aclima. For example, all our early research validating our methodology was done in partnership with leading environmental justice advocates, such as WOAP in West Oakland. And all of our work with regulators is centered in engagement with frontline and fence line communities, and that needs to continue to happen. It's a lot of hard work, as I don't have to say that. I'm sure the rest of the panelists will agree with me when it comes to doing this type of work, and it's been a really long road for us at Aclima, but the investment of time and energy and resources in building long-term relationships with communities is how we start to move equity and where we think there should be more work being done. One of our central commitments is job creation and training and benefits for environmental justice communities. Every time we deploy our networks in a new region, we engage local advocates and community groups to help us recruit from the communities that we serve. So that's really important. And I think more of that happening is what we would like to see. Also, providing training and expanding scientific literacy is a huge part of capacity building that has very long-term benefits, while also creating green jobs with full benefits and a path to career growth for individuals, all while solving this problem of reducing emissions, addressing climate change, reducing air pollution. And we're continuing to collaborate with governments and with communities and with businesses like those represented on this panel to build a model that prioritizes communities and make emission reduction efforts economically beneficial for environmental justice communities as a whole. So definitely, that's our thinking on that particular question, and I'll stop there.
Thanks. Chisato?
Yeah, I think, I guess one thought that comes to mind around this is, OpenAQ published a global state of play report in July of 2020. And this is based on the data that's available on the OpenAQ platform and also correlating it with government data accessibility. And we found that only half of the world's governments actually produce air quality data. So that actually means that there's over 100 country governments that don't produce air quality data around the world. So this is a huge gap. And so clearly community-based air quality networks are really essential to closing this gap and ensuring that there's air quality data coverage in places that there currently doesn't exist. And so I think that as we move forward in building the extension with the low-cost sensing platform, we need to be mindful about the community organizations that we're partnering with and ensure that the data that's available on the low-cost sensing extension is actually closing some of those data gaps. Because as you probably seen if you had visited our website, you'll see that most of the is in the US and in Europe. It's a completely blank map when you're looking at Africa, Southeast Asia, Latin America. And that's because either the government doesn't have air quality data monitoring available, or it's not open. And so I think that there are frontline communities around the globe who have been producing air quality data through the low-cost sensing network that need to be highlighted and integrated onto the platform, so that not only can the communities on the ground make a difference within their communities, but people around the globe, so scientists or journalists who are covering the air pollution problem in these countries are equipped with that data. And so that the burden of making change isn't solely on the communities themselves, but also there's a collective responsibility from different people across the globe, from different fields, to do something about it as well. And so we see this as a huge gap, but also an opportunity to really bring more attention to air quality as a field, and also to bring awareness to the impact that open data in particular could have in trying to get governments and private sector to really open up their data so that this could be a collective fight.
Absolutely. Thanks. I'll go over to Tyler and then Michael.
Okay, so indoor air quality. I think that's an incredibly challenging field to get into, considering how the intersection between personal and public space is. In the home, how much time we spend indoors, and the level of pollution through cooking or cook fires in certain locations. How do we bring this data into the equation? If we're looking at personal health, we need to look at holistic exposure. And indoor air quality is a huge issue, and really challenging to get at because of privacy concerns and the type of monitor you would need to get into the home. So that, I think, is a really important next step to take, is to start considering that in our mapping and studies.
Thanks. Go ahead, Michael.
I guess where to start. We've been working with the New York City Environmental Justice Alliance for the last couple of years. They're a umbrella organization that works with grassroots community-based organizations in many of the boroughs in New York City, all considered to be environmental justice communities, environmental justice areas of the city. And using the Airbeam, because it can both be used as a fixed instrument, one that you hang outside, it doesn't need additional enclosure, communicate over Wi-Fi or cell, but it can also be carried with you. So it could be used as a stationary monitor or a wearable personal exposure monitor. And so we did that, and we had a bit of a partnership with the Department of Health and Mental Hygiene in Queens College, which also since 2008 has been running something called the New York City Community Air Survey. And so it was an interesting collaboration in the sense that you have community-based organizations coming together with academics, coming together with government agency, using kind of multiple modalities for monitoring, and also looking to really combine the data sets. So what happens, can we combine the data from the wearable monitors with the stationary monitors with the data from New York City Community Air Survey and the data from the New York State Department of Environmental Conservation monitoring network, when you've only got 12 or 13 throughout the city. And so as important as I think that work was, what your question kind of points to is that, who bears the burden of supporting these networks outside of a specific project? So we did all this monitoring and then it all disappeared, right? Because we don't have the resources to sustain, a multi-year effort, meaning all the, it's one thing to buy the monitors. It's another thing to maintain them, to train people to use them, to maintain community engagement throughout the process. Those things obviously become bigger than a low-cost project. And in addition, I guess what I'd highlight here is that some of the work that's been done or research that's been put together by the Clean Air Fund. And what they've shown is that in proportion to the scale of the issue, which is people dying and being incapacitated by air pollution, the amount of money going towards that is very, very small. When you look at something like comparison, I'm not saying that one is more important than the other. When you look at the comparison with, say, HIV/AIDS, there's a lot more resources dedicated to that issue on a global scale, than there is something like air quality, even though air quality kills a lot more people every year. And so I think that it doesn't take much to basically have, cities and states and federal governments provide the resources to actually put these monitoring, this type of monitoring in place. That it can be done for a fraction of the cost. Something that's really expensive for a community to do is not very as expensive for some place like New York City to do. And in proportion to the scale of the problem, it's absolutely proportional. And what's being done now is absolutely underproportional. And so you look at places in the United States, rural areas, even mid-sized cities, they barely have any monitoring. Some of them don't have any monitoring. Not to mention the fact that the monitoring, even in New York City, where it's particularly dense, at 13 monitors, 13 PM 2.5 monitors for the entire city, you know, that's just inadequate. And it's inexcusable, really, that this is the state of our monitoring network, so government-run monitoring network, when the scale of the problem is so big, so serious, and the resources to address it, at least from a monitoring standpoint, are really relatively meager. So I think that that's really something that, you know, the people that I've been working with, community-based organizations, we've been advocating for, but it's very challenging, right? It's hard to go from an obvious problem and an obvious solution to going and actually implementing and getting the funding to do it. And there's not always a clear mechanism for achieving it. Yeah.
Incredible. I'm just digesting everything that each of you just said, you know, because these point to, as Michael, as you were saying, you know, we're not dealing with a pandemic, we're dealing with a syndemic, and, you know, we're dealing with these global level, and the air quality and air pollution are, of course, global issues, but we're dealing with these systemic kind of societal, philosophical problems when we're trying to address air pollution or any kind of environmental justice issue. So thank you all. At this point, I'd like to open it up to the audience for questions. So if there's anyone who'd like to ask a question, you can unmute your mic or you can type it in the chat.
And Jen, I guess while we wait for questions, you know, Michael's last point in terms of like resources, you know, one thing I would love to add is that, you know, one of the challenges for our industry, which is primarily focused on sort of innovating in the service of environmental justice communities, is that, you know, yes, identifying and securing resources is a challenge, but in climate tech, I mean, in tech, like climate tech and government tech, we've not received nearly enough attention at all from the investment community to invest in some of this technology. Silicon Valley in particular has spent a lot of time and a lot of resources investing in fintech more so, and also in ad tech rather than in climate tech and government tech. So that's also one of the limitations.
I'm hoping that someone in the audience is hearing this and saying, huh, this is where I'm gonna, you know, throw my weight into this problem, because there's no shortage of problem, but also the enormous potential and capacity is there and has been proven by each of your products and each of your technologies. Barring any questions from the audience, once again, Crystal, Michael, Chisato, Tyler, thank you very, very much for being here and having this conversation with us. So to kind of circle back to some of the logistical issues that we had earlier in the morning. So I've posted for this session the updated links, and I will go on to post the updated links for the next block of sessions beginning at 1:10. If I can copy, if my mouse will behave. There we go. So coming up at 1:10, we have a session on environmental justice, stormwater, and sewer backups in Baltimore, Maryland, and also Washington, D.C. We have a panel on environmental justice issues in Virginia, particularly talking about some of the successes, some of the good news with regards to the Atlantic Coast Pipeline and other environmental justice wins and victories in Virginia recently. And then we also have a session on the environmental public health tracking tool, which is being developed by our lab, Dr. Wilson's lab, in collaboration with the Maryland Department of Health. And this tool is kind of similarly to what we're discussing here, a dashboard type tool, an aggregator of several different public health indicators and public health variables alongside environmental factors and indicators. And of course, you know, we're throwing EJ in there as well. So that's coming up at 1:10. This room, I'll go ahead and close out at 1 o'clock. Panelists, is there any last words that you'd like to leave us with?
just a big thank you to have pulled us all together. I'll be contacting each and every one of you for further discussion. Thank you.
Indeed. Similarly, thank you so much, Jan. Thank you to UMD and to Kobe Wilson for pulling this pertinent discussion together. It's always great to see environmental justice being pushed. And I implore all of those in the audience to get involved. You have a voice, and we need your voice being added to the campaign so that these issues can be addressed and they can be made top priority for decision makers to help solve these problems. So really appreciate the opportunity to be here and to be on this panel with the rest of this phenomenal team.
Likewise, thank you so much. And hopefully this is the beginning of a longer term conversation and partnership, and look forward to staying in touch with you all. Really learned a lot from all the panelists. So a lot of food for thought. And I think as an organization, there's a lot of room for growth. So really looking forward to continuing to learning from you all.
Yeah, absolutely. I just will fourth that. Thanks, Jan. Thank you, UMD, and thank you, all you guys for joining the call today. Much appreciated.
Thanks, everyone. All right, so yeah, feel free to leave the room or turn off